I'm live. Today, slight rescheduling of time from normally we take at 3 o'clock. So today we'll do at 3:30. And I hope everyone joins in early so that we can start without any delay. Yeah, welcome Dr. Rohi. So we'll discuss a case before any questions is asked. This is a case where sometimes what happens, the patient starts and keeps repeating whatever said to him. For example, if you ask a question to the patient के ये तकलीफ कब से है, he'll tell you ये तकलीफ कब से है, 2 साल से है. आपके नेचर के बारे में बताइए. मेरे नेचर के बारे में बताना, मेरा नेचर ऐसा ऐसा है. So every time you ask the patient the same thing, he repeats the same thing every time. So you can say answers first, repeat the question again. Now this is, if this is happening in the whole case history, for example, when I took my webinar on November lecture, I told you that case of pulsatile, the changeability was there in every phase of his life. So this symptom which we are taking in for prescription, for example, answers, repeats the question first, that has to be in every time you answer the, or you can say maximum time when the patient is answering in the case taking. It is not always once and twice and the patient and you take that rubric. No, if the rubric has been, if the patient describes the symptom most of the time by repeating the same question first, then you have to take the rubric for prescription. And we give this patient a single dose of zincum metallicum. There are few remedies that you have to compare with the same rubric. You can compare that with causticum, medorinum, and sometimes you may think also of a very very rare remedy, that is, I've told this remedy before also, that is chenopodium. So we give that patient the single dose of zincum metallicum. Of course, there are other symptoms also, but this was the entry point of the case, the primary rubric. Okay. So welcome Dr. Nigam, Dr. Seeker, Dr. Mishra. On YouTube, there are some doctors. You can always give your introduction and you can start asking question. Yeah, welcome Dr. Meenal. You can start asking question. Otherwise, I'll keep explaining some cases which I have got in my practice. Nowadays, there is a lot of cases where the cough is there, and lot of queries on cough, what to give, what not to give. Remember, whenever you are prescribing in for cough, sometimes you have to take the surrounding also. How is the surrounding? Welcome Dr. Smita, Dr. Vishaka. You just missed a beautiful case of zincum metallicum. I hope you again watch the video and you can get the answer. Sometimes, patient comes there, a lot of doctors come and tell us, okay, what do you prescribe for cough and cough? And normally, most of the coughs which are presenting in front of us today have all dry cough. Sabhi cough, dry cough रहता है. It becomes very difficult then to understand what to prescribe. First of all, you have to, I will not tell you the rare symptom that cough alternating with skin, cough alternating with, this will be there. Only winter coughs we have, dry cough. Most of the coughs are dry, Whenever you have dry cough, especially winter cough, as we say, 2-3 remedies that I use in my practice with fairly good results. First is Rumex crispus. The second is Coccus cacti. The third is nitric acid. And fourth one, it is a very, very rare remedy that I would like to share today because, sometimes we don't think about that remedy, but still that remedy would give you good results. Especially, I am telling you today about winter cough. And that remedy is creosote. Now, creosote, if you ask somebody that for cough, nobody would say that creosote works for cough. But there are few symptoms of creosote which are very, very important, and then you have to take care of that symptom. Of course, winter cough is there, dry cough is there. 2 or 3 symptoms of creosote you must write down in your mater medica. That is, face appears very sick, the cheeks are hot and red. Why I am telling this symptom? Because when the patient of cough comes in front of you, you don't expect an acute cough to appear too much sick. But in creosote, the face appears कि भाई for long कितने दिन से patient बीमार है, and the patient says only 2 days since I have cough, but the expression is very sick and the cheeks are hot and red. Why I am telling you cheeks and hot are red? Because otherwise you have other remedies. You can think of belladonna, you can think of chamomile, you can think of other remedies also. But in creosote, this symptom is very, very important. One symptom in cough in creosote is there. In the throat, there is burning. Because whenever there is burning in the throat, we normally think about other remedies. But in creosote, it is there. इन क्रियोसोट रिमेंबर द पेशेंट आके बोलता डॉक्टर साहब मेरे को 2-3 दिन से सिंस 2-3 days आई हैड मेलेस वीकनेस था फीवर था आई टुक क्रोसिन एवरीथिंग इज ओके बट नाउ द कफ हैज स्टार्टेड माय डियर फ्रेंड्स if you don't have any other symptom and if the patient is telling you this symptom, please give creosote. Creosote is a very, very important remedy when the cough is there after influenza. One more remedy with creosote you have to compare. It is again very, very rare. That is iridicton. Creosote, like ammonium carb, is given in winter cough of old people with pressure on the sternum. Old people say, डॉक्टर साहब बहुत ज्यादा ऐसी भारीपन लग रहा है. Do ask the patient where is the heaviness, in the chest or on the sternum. In sternum, creosote is a very, very important remedy. And in creosote, after cough, if there is a lot of mucus, the expectoration is purulent. So these are the very important symptom of creosote, winter cough, which is again very, very rare. That's why I've told you everything about that. Also remember a very interesting, as I told you, creosote will complain about heaviness in the sternum. But some patient, old patient will say, डॉक्टर साहब इतनी खांसी आ गई छाती पूरी मेरी ऐसी खाली हो गई है ऐसे लगता है कि there is nothing in the chest. So which remedy comes to your mind? Anybody? Which remedy comes to your mind? Yes, Dr. Misha, welcome. Dr. Bablu, Dr. Minal, Dr. Redens Wong. Which remedy comes to your mind? Weakness of the chest in winter cough, sometimes dry, sometimes wet cough. Think about Stellum metallicum. And one remedy again which is very, very rare, you must think about Antim sulfuricum. Antim sulfuricum, please write down this remedy in your Mater Medica. Though it sounds very, very rare and very, very awkward sometimes, but it is a very, very important remedy. Antim sulfuricum or Antim sulfuritum, whatever you can pronounce. In this, of course, it is a remedy for very dry cough. And one symptom of Antim sulf is very, very important. It is in winter cough and the patient is sore all over. मतलब पेशेंट को हर बॉडी में दर्द होता है, कहीं भी हाथ लगाए पेशेंट को पेन होता है बिकॉज ऑफ द कफ. सो विंटर कफ एंड सोर पेन ऑल ओवर द बॉडी, you must think about Antim sulfuricum. Of course, it is a remedy for pneumonia when hepatization has occurred and there is no resolution. After hepatization, resolution should occur, but there is no resolution, and in that case, then you must think about Antim sulfuritum. Okay, these are the frequently used remedy which I use in my OPD. That's why I'm sharing it with you. So we can get to questions now. Urticaria after suppressed fever. Child has diffused urticaria with mild itching, darkness of neck and underarm. Okay, now acute symptoms. First of all, if it is there, urticaria, think about that. Welcome, Dr. Gurvinder, Dr. Nazim Dan, Dr. Bhumika. Now, yeah, Dr. Bharati, welcome. So, if you are taking only acute symptom, first of all, think first about urticaria, because what happens if you are taking acute symptoms and chronic symptoms and then repetizing, it would be difficult because that symptom was there since years. Now the patient says that he has urticaria. So these acute symptoms have to be treated, and in this case, there are a lot many of remedies. Anybody, can you guess the remedy? Urticaria topic, if you see in homeopathy, I have in YouTube, I have taken lots and lots of remedies for that. Now in urticaria, now this is a very specific question, so we can think about this. Urticaria, Antim sulfuricum. Yeah, doctor, you are right. So urticaria after suppressed fever. If the patient complains urticaria after suppressed fever, my dear doctors, if you don't get any other symptom, think about elatrum. Elatrum. Elatrum will work wonders think about electrum when the urticaria after suppressed fever, or urticaria after fever is also there. Suppressed is something different, but after fever, think about rus tox and epismel. And urticaria with fever, during fever, again rus tox, epismel, but you have to add rus ven. Okay. Dry cough, Lalit, welcome. Dry cough, slight discharge in throat, throat is sticta, don't give. Slight discharge in throat, rawness in throat. Think how is the discharge? Very, very sticky. Think about Nux vomica, think about Coccus cacti, or think, or these are the indicated, or think about Erydiction also. Sticta has different symptoms, No. After hemorrhagic fever or after any fever, electrum can be given. In my practice, I do that. See, whenever you are prescribing sticta, now see, winter cough, if you have seen my previous videos, winter cough, I have never told sticta, because sticta has something, a very, very different symptom as regards to cough. If you go and open sticta matermedica, whatever mathematics is using, there are 3-4 symptoms of sticta which are very, very important. First of all, in sticta, the cough is loose in the morning. First. Second, the throat is very raw. And third, dry cough during night. And whenever the patient inspires, there is cough. That is the importance of sticta. And if you remember, I had told one symptom of sticta which was very, very rare, that is pulsation from right side of sternum down to the abdomen during cough or during respiration. That is sticta. Fourth, you can think about the remedies, Nux vomica, Calcarea carp, and in fact, Rumex also would give you help. And sometimes, Drosser also works, because Drosser also has cuffs, and discharge is very slight. Ask about the character of discharge, sticky, viscid, gelatinous, then the remedy would be right. Copaiba on urticaria. I'll go to that. First, let me complete one question. Elytrum, lichen planus, no any history of stress. Lichen planus, very, very, lichen planus and psoriasis. These are the disease which basically, if you have heard my Insta or YouTube, I have taken lots about psoriasis, because psoriasis is, of course, a very psychosomatic disorder, and it definitely has the history of stress and whatever you say. Normally, in today's world, which I have seen in my practice, some patients are very precocious. You heard it properly, Dr. Joshi. Some patients are very precocious. And when we ask them, okay, why did you do this for your father, for mother, for your children? He said, sir, I was an elder child. So for me, this was quite normal. This is not stress for me. This is okay. Every child does that. So for the patient who is very precocious, he feels this is normal. But for the body, is not able to cope up the stress of finance, of career, of family, of spirituality, and then the body starts showing symptoms. That's why lichen planus or psoriasis, we say it is basically related to mind, and it is a psychosomatic disorder. That is very, very important. Okay. So I hope you take a case very precisely, and thank you for the heart, so that I know that people understanding. Both, Dr. Joshi, both you can think about this. Weakness in extremities and patient is anemic. Vertigo with headache, what medicine? See, whenever there is vertigo with headache, there are some things. Okay, first I'll complete, I think, Dr. Copaiba's. I'll finish that first, then we'll go to art. In Copaiba, one symptom is very, very important, that is hives or urticaria with fever and constipation. Fever and constipation, that is important. And it is urticaria with fever or urticaria during fever. It is not suppressed. Or you can say chronic urticaria in children, that is also Copaiba. So these are the two symptoms very, very important in Copaiba that you have to take care of. Now coming back to the question of Dr. Nigam. Weakness in extremities and patient is anemic, vertigo with headache, what medicines? Now, whenever you have, remember this, Whenever you have vertigo with headache or during headache and the symptom which you have told, weakness, please write down the remedies. First, you must think of calcarea carp, second of silicia, third is naxomic, and the fourth is conium maculatum. Maximum time I have got results with these remedies. Sometimes, if this does not work and you have to take the case in detail, you can also write down remedies like strontium carb, tabacum, and argentum nitricum. Wasim bhai, good afternoon. Valeriana, good afternoon. Yeah, so we have done that. I think any questions I've missed? Yeah, Dr. Babel, antim sulfureta Mars is the right remedy. Can we go further and very fast? It's already 3:46, and thank you all for taking time out. Because today we were half an hour late because of some other engagements I had. So thank you for everybody. I think all known names are there. So I think you're following me, and we are taking a very interesting topic. On Zoom on December 11, 12, 13, 14. That is 50 millisimal potency. 50 millisimal potency with cases. I'll be explaining 50 millisimal potency in detail. And I feel that my presentation would be very nice for all the doctors who want to know something, how 50 millisimal potency came into existence and how Dr. Hahnemann thought about this potency and how this remedy works and how to do repetition and where it is given in organon of medicine. It will be an interesting session. Do join me on 11th, 12th, 13th and 14th December because I have taken all the 4 days at a stretch because I have to basically not put gaps so that you don't miss out on what I have told before. That's why I'm taking at a stretch. So do join and it will be a happy teaching. And those who have missed my November series, we have that series whenever you want, the link we can provide you and you can watch that link, all the 4 lecture series in one link. You can watch that. For me, I've taken 4 cases and I have described it beautifully, all the remedies and all, and 50 millisimal potency for me because I've been practicing 50 ml potency with good results. So I can teach you the clinical part also and the theoretical part both. So meet you there. Will it be for English speaking students? Yeah, Dr. Babel, basically, it is mixture of both English and Hindi because we have a lot of students from India. So maybe when you come to Nagpur, Dr. Babel, to join the clinic, I'll explain you there also. There's no problem, okay? Or I'll take 50 millisievert potency in my international webinar also sometime. When to use LM potency and when to use CM potency. Yeah, we can take an international webinar also, Dr. Babel. When to use LM potency and when to use CM potency. Of course, it's a very detailed topic. CM potency I have hardly used. I can count on my fingers in my 25 years of practice. But LM potency, I'm using it very frequently. It's a long process to understand when to give, how to repeat, in which case to repeat, in which case not to repeat. So I'll be doing that in detail. First, you have to understand how 50 millisievert potency came into existence and how it is prepared and made and how it is dispensed. Okay. Where do we find the details of Zoom lecture? I think I'll get back to you. I don't know. I'll ask my assistants because they are maintaining it. There's one query, where do you find the details of Zoom lecture? Dr. Valina Berito. It is there on my Facebook, Facebook and Instagram. Please contact us on WhatsApp. My WhatsApp number is 9011 303 171. Both breast fibroadenoma, no results out of phytolica, pulsatilla, consumer, tumor, hard, not painful, menses regular with severe headache. Yeah, Dr. Joshi, fibroadenoma, previously, maybe 10 years back, I used to do the same thing, prescribe phytolica, conium maculatum, sister scan, calcarea floor, huangnang. So prescribing on the particular part of fibro, that symptom, But of late, I have found in most of the cases of fibroadenoma, there are some symptoms which you have to take care of. First of all, has the patient, it is related to hormonal, first of all. And for that, you ask the patient whether the patient has taken any type of pills to extend the menses, to suppress the menses, or there is a history in the patient's mother has taken a lot of pills, lot of these things to suppress the menses or take, and that is why the lady has got the girl has got fibroadenoma. Second thing, whenever the patient basically is in a state where he feels that he is fixed, वो फंस गया है, he is helpless, now he cannot move further in life, and that's why I have seen mentally the theme that fibroadenoma occurs. So if you ask me total symptom exactly what is there in the symptomatology, I would say there are few remedies which I used to use before. Sometimes it used to work, sometimes it did not work. So the remedies which I used to give was Sister Scan, Asteria rubens, Conium maculatum, Phytolacca, and Calcarea floor. Yeah, it is Zenith Rizvi, medicine for prednisolone toxicity. See, whenever you have cases of prednisolone toxicity, what I used to do previously, we used to give Naxomica. We used to give Naxomica. But of late, I have found that instead of Naxomica, it does not work properly. So basically, uh, I take the whole case. And if there are symptoms of prednisolone, like this question was asked on Instagram, put on Instagram, okay, like moon-like face, hirsutism, increased appetite, bloating of the abdomen. So there's a remedy in homeopathy, cortisol, and I have seen cortisol in again in LM potency repetition till the symptoms of prednisolone toxicity is improved. You can repeat at that time and then stop the medicine. Normally I start with LM1, and by the time I reach LM2 the toxicity symptoms are much better, and then when I shift on LM3 I basically tell them to take once a week or once in 2 weeks, and then gradually taper it off. Okay. Dr. Syria, okay, welcome. Registration for December series, okay, fine. So yeah, any other some questions have been scrolled up. Dr. Zenith, I hope I was able to answer your question. Okay. Next, yeah, thank you, Dr. Rizvi. And see, whenever I answer the question, make sure that you use that remedy. This is important because whenever we give a remedy, it is important that it has to work. It has to work. And if it works, then automatically we say that the remedy is right, and whatever I have told you, it is working properly. Now, bone marrow suppression due to chemotherapy. Now, see what happens. First of all, you have to understand what are the symptoms of bone marrow suppression. First of all, you have to write that. Whenever the patient has done chemotherapy, now just listen to the answer, Dr. Bhumika. Previously, again, we used to give radium brome, we used to give Anaxomega, allosocratin and all. But of late, there are a lot of cases who are coming. You must first of all understand bone marrow suppression has been done by which chemotherapy medicine. In homeopathy, now we have medicine called as cobalt 60, 5-fluorosilol, methotrexate. We have these remedies in potentized form. So if you know which chemotherapy drug has been given, you can give that in potency till the side effects of this drugs have been treated. Then you can stop the medicines. So of late, these drugs are also in the market. Then you must always think about that. Otherwise, basically speaking, Naxomica was a routine remedy a few years back which I used to give. And of course, think about radium brome. And one remedy which of late you must think about that remedy, and that is cadmium sulf. Cadmium sulf is a very important remedy. Okay. Welcome, Dr. Khattar. सर, एक आयुर्वेदिक माइंड मेडिसिन की ओवरडोज से मेरा माइंड का इमोशंस का फीलिंग खत्म हो गया, खत्म हो गया, उपाय बताइए. IS classes. Now, which medicine you took? Which medicines you took? See, whenever, if you are, I don't know if you're a doctor or not, I don't know, but if there is this symptom now, whatever there is a change constitution, जो भी symptoms वो दवाई खाने के बाद आपका change हुआ है, हम उसका case taking करेंगे as what Hahnemann says, and then we prescribe the remedy. तो उसके लिए कोई specific नहीं है. But you can definitely try Naxomic and Allosocratina, which would give you some results. Okay. Emotions की feeling खत्म. Medhavanti. No, I don't know actually the name of the medicine, but you can try नक्सोमिका डॉक्टर शर्मा जी, और आप किसी अच्छे डॉक्टर के पास जाके अपना पूरा हिस्ट्री दीजिए, और जो चेंज सिम्टम्स आपके बॉडी में आए हैं बिकॉज ऑफ दैट, यू कैन रेपिटाइज ऑन दैट सिम्टम एंड गेट द रेमेडी. बट बहुत सरप्राइजिंग है, मेरे लिए भी बहुत सरप्राइजिंग है कि आयुर्वेदिक मेडिसिन खाने से इतना ज़्यादा पूरे इमोशंस आपके खत्म है. इट्स वेरी सरप्राइजिंग एंड इट इज़ वेरी व्हाट वी कॉल, बहुत कॉशियस भी रहना चाहिए बिकॉज this type of symptoms you have, so must take definitely care of that. Sir, how to identify the frozen shoulder and what is the medicine? Of course, Dr. Husna, I think you were there on the November lecture, no? So if you have seen my pattern of prescription and pattern of taking case, I think you must have seen whatever I have done in that. Frozen shoulder, basically you have to ask the patient to know, it's a clinical diagnosis, you know. It is called encapsulitis also. It's clinically, you can see that it's a frozen shoulder, or you can ask the patient to go for an MRI scan and you can see the encapsulitis. Of course, frozen shoulder is a common symptom of diabetes mellitus, and that's how you can diagnose. And treatment is that, of course, treatment is right side and left side is there. You can think of sanguinaria, rustox, then calmia, latifolia, spigelia. These are the remedies frequently prescribed, you know, depending on the size of the frozen shoulder. Welcome, Dr. Palak. No feeling, no confidence, no emotion. So, Dr. Sharma ji, आपको basically we would like to take the whole case before. Okay, what was the personality before? As what Hahnemann says in the aphorism number 1, the physician's high and only mission is to restore the sick to health, to cure as it is termed. So, restore the sick to health. You have to restore what were you in Sora. So, the case taking is important in your case. Yeah, I've got the case, Dr. Sharma. That's what I'm telling you. Hahnemann has told in his aphorism 1, restore the sick to health. So whatever health harmony is lost, we can restore, but for that we need the whole case. That is important, you know. The whole case is very, very important. Yeah, so I hope you got that. Any other question? Instagram had questions, so it has. Dr. Bhumika, I hope you understood. There are some question on my WhatsApp. Please don't put on the WhatsApp. It becomes difficult, you know. Yeah, that's the same question. They want the recording of November lecture. You can get. I have told them my mobile number also. And I would like to tell my assistant to put the mobile number so that you can contact me in mobile number. And you can contact them basically. And they'll do the needful. Yes, any other? Dr. Suroya, welcome. Oh, if you understood the question answers, do give me some, you know, thumbs up and heart so that I can know. Otherwise, I feel what to answer more. So one question, backache. You know, there is a very common, you know, in pregnancy. In pregnancy, there are so many symptoms in the body going on, and we have classical rubrics, classical symptoms, you know, related to pregnancy. I just had a very interesting case of pregnancy where the patient had so much constipation because she was pregnant, and plumbum cured the case. In this case, whenever you have lumbosacral pain during pregnancy, 2 or 3 remedies that comes to my mind is, first is kali carb, second is belladonna, and third is semesifuga. Of course, rustox is also there, but kali carb, belladonna, and semesifuga are very, very important remedies. If you ask me, you can first think about kali carb. Dandruff, itching, white. Normally, Dr. Bhumika, do confirm it is actually dandruff or it is psoriasis. Now, dandruff, itching, white, you can have a lot of remedies, like you can start with, you know, phosphorus, and one important remedy you can write on vinca minor. And one again very, very rare remedy, Dr. Bhumika, that is Cochlearia. Previously, about 10 years back, if the case of dandruff was there and I wanted immediate relief, you know, we used to use Cochlearia mother tincture, coconut oil, put Cochlearia about 10-15 drops, mix it and apply on the scalp. it works very well and it gives fantastic results, then you can take the whole case and give the remedy. So Kochkilaria, Vinca minor, of course phosphorus is there also. So these two remedies just struck my mind. Use these remedies in your practice. So my dear friends, already half an hour up. Thank you for your patient hearing, and thank you for doctor. I would say I would take next time because I have an engagement, one more to go somewhere. So yeah, I've told you, you can contact my mobile number and write the whole case, then we can get back to you. So thank you for your patient hearing. I hope you enjoyed as much as I enjoyed you teaching. Thank you so much. Until next time on next Saturday on both Insta and YouTube Live. Thank you.